A big hello to the People's Nation. This is Brandy Brooks in your hostess seat, and we have at the station today Mr. Billy Webster. He is a gubernatorial candidate for the governor's race here in South Carolina. How are you doing today, Mr. Webster?
Fine, Brandy. Good afternoon to you.
Great to have you stop.
Thank you. Very nice to be here.
So tell us, who is Billy Webster?
So, Brandy, I was born in Greenville, lived there most of my life, although I spent 7 years in Washington working for then Secretary of Education, our old much beloved two-term Governor Dick Riley, and I worked in the White House for Bill Clinton. But I've spent most of my life in business, also spent it in the areas that I care a lot about. I was chairman of the board of Prisma Health, which is the largest healthcare company, hospital in South Carolina. I was chairman of the board of the Nature Conservancy, which is the largest conservation organization, and I was chairman of the board of Converse College. So you can kind of take from all three of those that I care a lot about healthcare, education, and conservation.
Awesome, awesome. Let's start off with healthcare.
Okay.
So you talk a lot about healthcare within your platform and Medicaid expansion.
Yes. So we've got 500,000 uninsured people in South Carolina. That's about 1/10 of the population. And because of the way the Affordable Care Act subsidies work over the next 12 to 18 months, a lot of those will be eliminated or cut back. So we're going to add substantially to the rolls of the uninsured. And there's obviously a human cost to that, but there are also tremendous social costs. Everybody who's uninsured actually gets health care. They go to the hospital, but they don't pay because they have no health insurance. So hospitals serve those customers, and it is called uncompensated care. And in order to compensate for that, all of our health care premiums go up. So if we expand Medicaid in South Carolina, the benefits of it are many. We insure 500,000 people who are not insured now. We lower health care premiums for the rest of us. We will keep rural hospitals open because they close because of that uncompensated care problem. The number of military vets that have health care will go up. Crime rates typically go down in states with Medicaid expansion. And of course, it will create about 25 to 30,000 jobs as all of those folks, again, are eligible for health care that are not now. And the revenue implications for that for counties is substantial. It's about $150 million a year.
Wow.
It's a big deal in this state. To me, it's the single most important public policy issue that we face is that 1/10 of our population is uninsured.
Right. And you also, on your platform, talk about the infrastructure and the environment.
Right.
And so how would you protect the landscape while trying to build the economy?
It's a great question, and you kind of have to start and size what's going on here. We've had 1 million people move to South Carolina in the last 15 months. We'll have another 1 million people move in the next 10 years. Since 1992, which is when BMW located in Greenville-Spartanburg, the population of this state has increased by half. Mm-hmm. We didn't plan properly for it, and we're not ready for further growth. Conservation, development, and infrastructure are all three legs of a stool, and they have to be dealt with together. You can't continue to develop at the rate we're developing because we have sizable unmanaged growth, urban sprawl, and all of that affects clean water, all of the beautiful places, as you phrased it, the reasons people move here. I mean, we got beautiful mountains all the way to the coast, saltwater, estuaries, beaches, and all of that needs to be protected. So we've got to have a statewide development plan, a statewide conservation plan, and a statewide infrastructure plan, and they all need to be overlaid on each other so that they make sense and that three-legged stool is able to stand up. You knock one of those stools out, and South Carolina falls down. If we don't do something now, we'll be a parking lot in 15 years.
Wow. Interesting. Very interesting. We're going to take a quick pause. When we come back, we're going to talk a little about education.
Yep. Great.
All right. Well, we'll be back. You're listening to the People Station at 3.7 FM. And we're back. Thank you for hanging out with us. Again, this is Brandy Brooks speaking with Mr. Billy Webster, gubernatorial candidate for the state of South Carolina. What are your plans for our education system?
So we could talk about this all day, Brandy. As you know, as I said earlier, I work for Secretary of Education Dick Riley. I was his chief of staff. I want to start with a really important issue that OC Tech, for example, is involved in right now. All of our graduating seniors need to begin in about 8th grade planning for what life is going to look like on the other side of graduation. We need highly qualified guidance and career counselors who can give each graduating senior a clear path to a job or the military, but something that those kids can visualize and get wrapped around and get passionate about. A lot of that is going to be, it could be trades, it could be going to a 4-year school. You know, Orangeburg is blessed with 2 great HBCUs. There are lots of education opportunities, but to me, there has to be a clear nexus between high school and career, and that's job training. And OC Tech, career colleges, technical colleges, community colleges have to be at the heart of that pipeline from high school to a good paying job with benefits.
Right, right. So what's your vision for South Carolina? What's your overall vision?
My overall vision is I want South Carolina to be a place that my children and my grandchildren want to live, move back to if they're not here, or live in. And that means we've got to have good paying jobs. We've got to protect our beautiful places so that South Carolina has the appeal that it does today. We've got to have an education system that works for everybody. And we have to make sure that our population is healthy, and that is going to require Medicaid expansion. There is no other way to be the kind of state we want to be when 1 out of every 10 of our South Carolinians have no health care.
So what last thought would you like to leave with our listeners? Coming from Billy Webster, gubernatorial candidate for governor.
Well, I'm always privileged to be in Orangeburg. My father was the first non-African American on the board of South Carolina State University. I taught economics there, so I spent a lot of time here. Dr. Maceo Nance was president of the university when Dad was here a lot, and you know this city of Orangeburg's got a lot of good going on, and I'm always happy to come here.
Awesome. Well, thank you for hanging out with us.
Thank you, Brandy.
All right, you've been listening to gubernatorial candidate gubernatorial candidate Billy Webster. This is the People Station 93.7 FM.
Thank you.
You're welcome.